Okay, so thank you for that. Probably a bit of a change of pace, I'd reckon, here with this presentation, instead of going through the intricacies of biochemical pathways and the process associated with that. Today's presentation is really a bit on policy and in the context of health reform. I suppose for a second I'd like you to imagine yourself perhaps as the most powerful person in this country. If you were the most powerful person in this country, you'd probably be the Prime Minister. And if you were the Prime Minister of this country, you'd probably recognise that the health system is, in certain sectors, hemorrhaging uncontrollably. We see it as providers, in the sense as delivering healthcare. Consumers are feeling it, and the system is suffering with it. I suppose today what we're going to show you today is go through the sectors regards the actual health problem. What are those factors? As part of my Masters, I'm actually developing, I'm trying to change healthcare. Small sort of role, I suppose. We're looking to develop a health promotion toolkit in primary healthcare. So as a chiropractor, we're looking to do action research, to go into chiropractic clinics to start with, to see how chiropractors deliver health promotion information. Because as some of the research I'll demonstrate to you later will show, that we're not doing it that well. And the area of that's where I've had to research to ask, to justify why we need to make this change. I've had to do it in an institutional perspective at RMIT University to justify them paying for a research position. And I suppose that's something we'll be writing up with to manifest in the sense of why the health system needs to be changed. So we'll look from a lobby group perspective as well as the actual reform group actually doing the change. And it's all very current. It's all happening very much as we speak. I'll entertain with you a new primary care model, some research that's been put together overseas in the US, and entertain that conceptual framework, which is totally different to the way we practice today, but in the context of the healthcare system, I suppose, needs to be explored. If we look in the context of the health problem, we can see the sectors that are involved. We obviously have the regulatory body, which is government. We know we have another component, which is the media, in the sense of how they send the message of health to people and society. If we look also in the sense, obviously, the end product of the healthcare system is the consumer. If we go regards the delivery, obviously we have the health professional, which obviously is broken down to the two components of natural and medical in regards to its management. In effect, I suppose, one word sums up change if we are going to actually instill health reform. Every sector has to take a sense of responsibility. From the consumer to the health provider to the system. And at the end of the day, I suppose, what it requires is key stakeholders also to drop the batons in order to communicate between professions and also intra-professionally as well. And my sense of confidence of that happening, I suppose, is I'm not too certain, because of the requirement of a maturing of human beings in a setting, in a group, to actually agree to disagree and move forward. But fundamentally, if we're going to get serious about health reform and actually changing the healthcare system, we have to walk into conversations and discussions at a political level with that intent. And if that's not really met, it's going to be quite challenging. So regards the health problems, we're going to dissect it into different components. What is the health problem? So from a media perspective, regards portraying health the wrong way, if we look at the sort of images that health conjures up here in, for instance, magazine articles and front page excerpts, I suppose this conjures up the image that health is really a quick fix. You know, we're going to look at situations of magic bullet type potions. And let's be honest, if we look at the climate, it's not so much even just a pharmaceutical perspective, because that's what patients expect, don't they, when they perhaps see a conventional GP and expect a change in healthcare or their health problem instantaneously by taking a pill, pharmaceutically speaking. But also, even from a nutritional perspective, it's a fairly similar sort of context, isn't it? In the sense of requesting a quick fix for a change as well. And fundamentally, I suppose, this sort of image needs to move forward a little bit from a quick fix sort of mentality. I did an interesting exercise where I actually went through Microsoft clip art. I want to see what Bill Gates considers health to be equivalent to. And here are some of the images that we actually came up with. Is health a breakfast bowl of pharmaceuticals? Is health equal to a happy hospital doctor? Is health equal to maybe a more scary-looking hospital doctor with a weapon called a stethoscope? Or if you've got more of a complicated issue, you could click up here and you have health with a family of a horde of happy hospital doctors looking after you. If you look at a cartoon image, we can have a situation here where we've got a child probably having additive-laden ice cream on intravenous antibiotics, probably watching some crime TV. Is that what health is all about? Or in the context of a character who looks very sick, or a chap who looks like could be Clark Kent but smoking a pipe. It's a trivial exercise, but what I'm trying to get across to you is, in this context, health equals illness. And that is half the problem. Versus, I suppose, the context of health equaling vitality. Because in these sort of elements here, I suppose this requires an investment. Each angle here. Exercise, walking, relaxation. And it is really a contradiction in terms to our current westernised environment. And also contradictory to the context of a patient coming in wanting a quick fix. Completely contradictory. So in a sense, I suppose, there needs to be changes in a lot of different sectors and different groups in order to us to change the healthcare system. And the next group, of course, is the consumer. Because fundamentally, the consumer has to make health a priority. I've been in practice 13 years, and I'm sure there's people here who've been in practice double that time period. But as I move more into practice, I realise probably the most fundamental facet of practice is health psychology. That is fundamental to actually encourage behaviour change. We are, in effect, behaviour change agents, in effect. How we deliver the mode, whether it's pharmaceutical, whether it's integrative, whether it's natural, we are still all having one intent, to change behaviour. And basically, if we don't change behaviour, we've probably failed in the actual health outcome situation. Health psychology is really an important sort of context, and I suppose it's even more important when we look at the fact of how consumers view their health. I'd be interested to know if you could put your hand up here if you find these statistics astounding or not. As part of our literature review, we've had to review the National Health Survey NHSA current Australian health findings. And in the opening sentence of the executive summary, it states that the majority of Australians consider themselves to be in very good or excellent health. And statistically, the survey showed that 50%, over half of the people aged 15 years and over, consider their overall health to be very good or excellent. Does that shock you? Hands up, does that surprise you? Or is it a case where it's like, maybe do we consider the consumers maybe are in a bit of delusion regards what their health is as a context? Perhaps I'm getting more affirmatives there. Well, let's take these statistics a bit further. Because if we look at body mass statistics, and we all know BMIs aren't the most accurate phenomena in the sense of measurements of weight of health, but however, if we look at the age group of 54 to 64-year-olds, 72% of males and 58% of females are classified as overweight or obese. So this is from the same research, the same ABS statistics, the National Health Survey.